So we have a patient here, a young girl, who is complaining of some scars in her chin area. So let's discuss what is a scar and how do we treat it. This young patient, she's about 23 and she had a injury about 12 years back when she was small, and she had a lot of wound here in the chin area and below her lips, and she has kind of have a big scar which is like a trapdoor scar which is seen here. If you can come closer, you can see that there is a scar here. Now what exactly is a scar? Is basically, a scar is when there is an injury to a tissue, any part of the body. So the wound heals, and the wound heals by forming scarred collagen. So it's the same collagen, but it's in a different type of collagen which kind of heals. When the body is healing, is forming that kind of a tissue. So that's called as a scar. Now there are various modalities how to treat scar, and we should know that the scars can be atrophic or hypertrophic, and a few scars are also keloid. So the hypertrophic scars are when there is excessive amount of collagen which is built up on the skin, and atrophic scars are basically kind of ditches which are formed because of loss of the tissues, loss of either the fat or there is loss of the muscle or whatever it is. There is a depression there. Most of the times we see these atrophic scars in acne because of tissue damage and because of chickenpox. These are traumatic scars basically. Now there are various ways of treating scars. Some people non-surgically they camouflage it. They can do tattoo on it so that kind of it gets camouflaged. There has been usage of steroids there, and then patients what they do is they kind of do microdermabrasion, wherein kind of superficial layer of the skin is taken out, and then nowadays the most commonly used procedure is basically the CO2 fractional laser, wherein the CO2 basically ablates the superficial layer of the skin. Actually, she has undergone a few sessions of CO2 laser, but then she didn't have any results whatsoever. So we have decided now to go in for the kind of revision by doing something known as a dermabrasion. Dermabrasion basically kind of it exfoliates, or it takes off the superficial layer. The epidermis is taken care of, it's taken off in that area, and then the papillary dermis to some extent is also taken off. So once that is taken off, the new skin which comes out is of a better quality, and the scar becomes less evident once this new skin is formed there. So what we have to here understand is we are taking out epidermis plus the papillary dermis, so that the new skin which comes is of a better quality, and eventually the scar looks less evident there. Now what is very important here is the patient should be informed that the reepithelialization can take anything between 1 to 4 weeks, and then the wound actually becomes pinkish, and then the pigmentations to come, because we are also taking out the melanocytes which are there. So we are taking out the melanocytes, so to have that kind of skin color, it may take anything between 4 to 6 months, sometimes 8 months also. That is what we have to always explain the patient when we are doing dermabrasion. So dermabrasion is actually a surgical procedure, as I mentioned, but it is the most effective procedure when we are talking about scars. So in this kind of situations, so what we are doing, I'm using bupivacaine here, which is basically a long-acting anesthesia. It works for almost 6 to 8 hours. I've given a little mental block, but what I will also do here is I will also give a little bit of a tumescent, wherein the skin is raised, okay, and hold this, okay, and then we are going to have one is I have already given mental nerve blocks here to anesthetize the whole chin here. Plus, I am also giving her a little, tumescent, which will raise the skin up and make it firmer, so that it helps us to remove the scar there. So what we use here is basically a burr, which is a coarse burr. Can you just turn this side, please? Sorry, thank you. So we are going to use a coarse burr here, which is mounted on a surgical handpiece, and that's going to kind of abrade the whole skin. So I am giving the tumescent here. I have given her the blocks. So this is a very effective modalities and deeper acne scars, probably the best when we are talking about the treatment of acne scars, because sometimes the CO2 fractional, which is supposed to be the treatment option for acne scars, the treatment option for the acne scars, the patients do not get very good results. But then if the patient is ready to undergo a downtime of about say 6 months or so, 8 months, I think this is the most effective treatment modality which is available for any kind. So we have given the tumescent anesthesia. It's firm now and it is going to be very easy for me to work here. The same thing which I have done it on this area also. Okay, so that's the first thing which we are doing. Okay, so now what we are going to do here is, this is mounted on a straight handpiece, a surgical handpiece, and this is the burr. If you can see that, it's basically diamond coated coarse burr which is there, and it rotates at slow speed, not a very high speed. Okay, so this is how it's going to rotate. So what we are going to do now here is, just look up please. Perfect. So as I said, we have to abrade the skin till we start getting the bleeding spots, minute bleeding spots. Just let me know if you have pain. Okay. Okay, so we'll start from here now. Slow drops. Pain hai? Very good. So what we're going to do is, we're going to abrade the skin there. So you can see slight amount of, the changes have started, because I am just removing the epidermis at this point of time. I am at the epidermal layer. So this is what I am going to do all around, but then I am going to go deeper. That's almost till the papillary dermis. Okay. So as I said, CO2 would have been is the in thing, but she has undergone sessions of CO2 without any results, so she doesn't want this. And patients at the marriageable age with acne scars and all those things, we have many patients who come to us, and the best treatment, as I mentioned, if they are ready to undergo a downtime of about 6 to 8 months, I think this is the treatment option which can be kind of given to the patients, and they actually give very good results. So post-operatively, we are going to put her on some antibiotics for 5 days and some anti-inflammatory, and obviously some dressings here around, and strict no sun exposure, the patient needs to be mentioned, and the patient has to follow that, otherwise she is going to have severe post-inflammatory hyperpigmentations around. Dermabrasion is also a very effective treatment modality for the kind of tattoos which normally do not respond to the anti-ag lasers. So we have effectively used dermabrasion for kind of tattoos which normally don't go with the anti-ag laser. This point of time also, now it is looking less evident. That's because we have abraded the skin around the scar there. So over a period of time, what happens is the skin heals, and when the skin heals, it stretches out and the scar looks much less evident there. So in the same way, we would be doing a little more on this side, on these areas we would be doing a little more, and then we would be giving her a good amount of dressing with 5 days of, hold this please, 5 days of good antibiotics and good anti-inflammatory. And as I said, the most important thing is prevention of sun exposure. That's very important. But as I said, dermabrasion is the most effective modality for treatment of any kind of atrophic scars, be it traumatic or be it acne or be it chickenpox scars. The only problem, as I said, is basically the downtime, and if the patient is ready for the downtime of about 6 to 8 months, is the most effective way of treating it, because even CO2s cannot do what dermabrasion does. Thank you for watching us, and if you have any queries, please let us know. We'll be more than happy to kind of answer you back. Thank you.